There's no downside. Don't take it. You'll be uncomfortable. It won't be as easy, maybe, but don't take it. If you're pregnant, don't take Tylenol. And don't give it to the baby after the baby is born.
President Donald Trump strongly recommending that women limit acetaminophen use during pregnancy. Good evening, I'm Febin Casahoon. The president announcing today that the U.S. Food and Drug Administration will be notifying physicians that use of acetaminophen during pregnancy, quote, can be associated with a very increased risk of autism. Concern and confusion flying around this recommendation, which is why earlier today I took some extra time to sit down with the president at Oishei Children's Hospital as he answers some of your questions. Are there any specific age groups or conditions that make children more vulnerable to these side effects of Tylenol?
Really, it's the fetal brain that we're talking about. And one of the reasons why I think there's enough caution here is in animal studies, we have seen the effects of acetaminophen or Tylenol on the growing fetus. And so we know that Tylenol can cross the placental border. And what happens then is the blood levels in the fetus can reach about the same blood levels in the mom about an hour after she takes it. So we know that it's in the baby. Then we know that it can affect the brain, and as it's metabolized in the brain, it can actually cause toxic metabolites, so it can be toxic to the brain. The other thing, Tylenol can impact the endocrine system or your hormones. And hormones also, when they activate, can help develop the brain. And so if you're disrupting that, you can disrupt the normal brain development patterns. The other thing is Tylenol can impact the way that genes are expressed. And so as you are growing a baby inside, all those genes are giving you instructions on how to build your body. And if Tylenol can impact the way that genes are expressed, it can impact the instructions that your body is using to build your brain. And so because we've seen that in the animal models, we know that there is a potential effect in humans. When you put that together with the studies that show that there is this association, one raises the question, could this be a cause and effect? So right now we don't know for sure, but I think it is worthy to be cautious.
When they say right now they don't know for sure, do you know when they'll know? Is obviously more studies, but is there like a timeline that they've announced?
So there's multiple studies that are going on right now. I think one of the challenges is Tylenol is so widely used. And so to try to say that that one thing is tied to something else when there's all these other variables, whether they be genetic, other diseases, comorbidities in a mom, socioeconomic factors, all those sort of things, and try to tease out and say Tylenol use is tied to this, it's very, very difficult.
So for those who are concerned about this situation, what do you suggest?
So I would say talk to your OBGYN. If you have pain that's not being controlled with non-medical treatments, non-medication treatments, or if you have a fever and an infection, definitely talk to your OBGYN. If there's other things you can do that are non-pharmacologic to help both those things, certainly try those. But again, if it's getting worse, you don't want to have ongoing fever and you don't want to have ongoing pain because that in and of itself can cause harm to the fetus.
You can watch the full 10-minute interview with Dr. Turkovich and I right now on WKBW.com.